All right, good evening. So today what we're going to do, because on Tuesday I did not get as far as hand washing and infection control. So I do want to go over infection control and also what I'm probably going to do, we'll see. I'm going to go over infection control and then I'm gonna go over hand washing. But there are some topics that I already have saved, and then that way you can actually review and listen to the video later. So first I wanna go over infection control, because going over infection control is very important. Remember I mentioned as phlebotomists, you're gonna be dealing with all type of bodily fluids. So I want you to know how important it is to make sure that we know where germs come from, how they live, how we can stop them from living and things like that. So it is a video. So I'm gonna play that video for infection control, and then I'm going to explain myself about infection control. Then I'm going to talk about hand washing. Infection control is not per se on your national exam. Infection control is just a real life type of information that you need to intake. Okay, so let me go ahead and share let me first find the video so I can share my screen and show the infection control video that will be recorded as well, because everything that is shown while I have the recording on, you will be able to see. So hold on one second. Let me get the video together and pause it. All right, so we're gonna go ahead and play the infection cycle.
Welcome back to Phlebotomy Solutions.
Video is basically, I just want you to understand how bacteria grows. Again, I will explain everything after the video plays, okay? Give me 1 second.
And this PowerPoint presentation will be the infection cycle. So let's begin with the terminology of words in reference to the infection cycle. We have the droplet infection, which refers to the sneezing or nasal fluid that might be coming out. This is infection cycle that can spread through what they call droplet form. So if someone's sneezing, which can go up to 20 feet, or touches the nasal fluid from the nose and touches, these are part of the infection that a virus or any kind of infection can spread through that droplet form. We also have the incubation period. Now, this incubation period is referring to the time that the patient has the virus or infection, and that time that shows signs and symptoms of it. That in-between phase is called the incubation period. So they require the virus or the infection, and the time they showed the signs and symptoms, that in-between phase that showed nothing is the incubation period. And of course, susceptibility. Who is more susceptible to get the virus or the infection? That determines on their compromised immune system, which can be with children of infants to newborns who don't have a fully developed immune system yet, or geriatric patients who are immune compromised, as well as HIV patients or patients who already have another pre-existing disease prior to that. Their immune system could be compromised. As well as, now let's look at direct contact. This is where the patient directly contacts with you by handshakes or some kind of touching. This is referred to direct contact, and this could also spread the infection or the virus to the next person. Then we also have indirect contact. This is more of a third-party contact where it could be a doorknob or a handle or a silverware that you put in your mouth or touch. Sometimes these bacterial or viruses can live on a surface for quite a while, for a number of hours. So we got to be careful when we talk about these five, and we need to understand what each one refers to when droplet, incubation, susceptibility, direct, and indirect contact in the infection cycle. Now let's talk about the infection cycle chain. Now, as we can see here, there are 6 ways or 6 pathway that the infection cycle moves. One, you have to have a pathogenic organism or microorganism, as we can see at the very first. We also have to have a reservoir where this pathogenic microorganism lives or resides. Then we have to have what we call the means of escape, that how it leaves the reservoir and escapes out of it. And of course, in what way is that mode of transmission? It could be through drinking water or eating certain foods. And then, of course, how is it entering? Is it entering through the mouth? Are you breathing it in? These are ways that we talk about means of entry. So again, we have the reservoir, means of escape, mode of transmission, means of entry, and of course, we have to have the host or susceptibility. Who is most likely susceptible person to this virus or infection? Is it an immune compromised individual? Is it geriatric patients? Or maybe it could be a newborn or an infant who has an underdeveloped immune system. So again, this is the infection chain of cycle that goes, and the only way this chain can be broken, the only way is through proper hand washing procedures. That will break any chain of infection. Now, what are some of the growth requirements for a microorganism or microorganisms? Well, we have to have a good oxygenated area. We have to have moisture sometimes. Good nutrition in the area that the growth requirement for microorganism might be, where it feeds off of. We have to have a temperature. Some microorganisms live in damper places, colder, or even warmer places. We have to have darkness. In some cases, or even in most, darkness is a necessity for microorganisms. And of course, for a proper pH balance. These are, of course, the 6 things that are requirements for microorganisms to live. Now, not all of these can be in this order. You could have 3 out of the 6, or 4 out of the 6, or even 2 out of the 6. But these are the basic requirements: good oxygen, moisture, nutrition, temperature, darkness, and a proper pH balance were growth of requirements for a microorganism. Now, when talking about certain infection agents, there's usually typically 4 basic ones. We have bacteria, we have viruses, we have fungi, and of course, we have parasites. Now, these, of course, are considered infection microorganisms that can live in any of those other areas we talked about. And they can usually spread sometimes, like we talked about, direct contact, indirect, or even in droplet form. So, again, we got to consider the bacteria, virus, fungi, and parasites when we discuss infectious agents. Now, when dealing with infection control, we have to look at the standard universal precautions. Number one, we got to consider all blood and body fluids potentially infectious. Always. It doesn't matter who we're drawing or who we're looking at, if it's a family member, neighbor next door, we have to consider all the blood and body fluids potentially infectious. And that means we use personal protective equipment, or PPE, to prevent exposure. And again, it doesn't matter who you're drawing on. You must consider everyone possibly infectious. And of course, the slogan: if it is wet and sticky and it is not yours, do not touch it without gloves. So, what are some good control requirements for microorganisms that can actually prevent them from latching onto you, or actually infecting you? Well, good physical condition and staying healthy is one. I mean, if we eat right, stay in good physical shape, that's one way. We can look at good emotional state. Stress has a lot to do with compromising the immune system. So a good emotional state does help in controlling the requirements for microorganisms to attach and live and grow, as well as having proper exercise. A good physical, staying healthy with the proper food, proper exercise, even if it's just a half an hour a day or every other day. Proper exercise is good control, as well as good nutrition. Again, goes back to the eating. We have proper hygiene. This means bathing, daily if you can, or at the longest every other day. But typically, if you can, bathing or rinsing daily is great. Reducing stress. So we talked about having stress does affect the immune system and can actually help grow certain viruses or even bacteria in your body and spreading from there. So even certain diseases can come through stress, as well as this goes back to not eating correctly nutrition. Disease can form. Limit direct and indirect contact as much as possible. Dealing with patients, limited to just what you need to do. So if you're drawing blood, just draw blood. There's no point in having any more contact than just the drawing the blood, or even with the indirect contact. That means restroom handles and doors or sinks. The less direct and indirect contact you have, the better the control. And of course, use standard precautions. This again goes back to PPE, protective equipment. Using your personal protective equipment and creating that barrier between you and the patient so that microorganisms do not latch on. And even having to wear masks, so if the patient does talk or has something that could be considered droplet, having a mask on so it doesn't spread. And of course, referring to infection control, the breaking the chain, washing hands before and after you handle a patient. Again, before and after you handle the patient, washing hands breaks any infection control chain. Now let's talk about the infection control sanitization. The number one infection control action is soap and water, and this is at the most minimal basic level. Anything else, as you can see from the picture, requires more of the heavy duty gloves when handling certain agents like bleaches or other heavy chemicals that require these protective gloves when sanitizing certain equipment that doesn't get disposed of. So whether you're washing your hands or handling equipment that does not get disposed of and using heavy chemical agents, of course, using your PPEs for those and your mask as well as soap and water can break any infection chain cycle. Now let's review. How are infectious agents transmitted? Well, we talked about improper hand washing, which is the number one chain breaker of the infection cycle. Proper hand washing does it all. And then, of course, contaminated instruments. Handling instruments that have not been contaminated by bleaches or rinsed or washed down. This is also how infection agents are transmitted. Body fluids, we talked about the sneezing, the droplets, but also dealing with blood or certain fluids in the body, urine. These are also infection agents that can be transmitted. So body fluids is another. And of course, through needle sticks. This is one of the areas where we need to be careful because a needle stick, a used needle that you stick yourself with, can transmit an infectious agent into your body. So if you ever get stuck with the used needle that you just use on a patient, then you must get to your do the protocol of the hospital or the clinic or the lab you're at. Follow the protocol because you're going to have to get checked out yourself and the patient to determine if there's anything infectious that was transmitted. So again, improper hand washing, contaminated instruments, body fluids, and needle sticks. These are all how infection agents can be transmitted. For more information, please visit Phlebotomy Solutions.
All right. So that's the end of the video. I just want to reiterate some things with the video. Remember, this is the infection control cycle, and it talks about how the infection
through that drop.
how the infection is start. Okay. So for example, when we're in person, I will go over certain areas on the difference between airborne precautions and droplet precautions. But I do want you to know germs are transported in either way through droplet infection, meaning if somebody cough or sneeze, it floats in the air enough for 6 feet, then it goes down to the ground. So if you're close in that person's personal space within 6 feet, then, and if they have anything of contagion, then you can possibly go ahead and attract whatever it is that they have. For people that are weak immune suppressants, meaning that they are constantly sick, it may be a chemo patient or anybody, or even an elderly person or young children. They are susceptible to actually contract an infection more so than anyone else. And you can get any type of an infection per indirect and direct contact. Direct contact means, okay, if I have something going on my hands, you and I shake hands, and then what was on my hands, you didn't wash your hands, and eventually you contracted whatever it is that I had. That's direct contact. You actually directly touch me. Indirect contact, meaning that those same dirty hands that I have touch the doorknob, You didn't touch me, but you touched that doorknob after I touched it. So if there's anything of contagion, then you can possibly contract what it is that they have, okay? So when I go further on, now this is the actual infection control cycle. So what this means is that you definitely have to have a pathogenic microorganism first, which is right here at the top, the little burnt orange chain, meaning that the germ or the bacteria is there. But then if it continues to live, then now it has to have something like a reservoir where it's living from. Rather it's growing in a wet, moist area, rather it's feeding off of other bacteria that's in the area. A reservoir means that's where that germ is living and it's multiplying. Then we have the means of escape, and the means of escape meaning that maybe it was living on your floor. Okay, maybe someone dropped a chip or something and they put it in their mouth. Now it escaped from the floor, and now the mode of transmission is that you ate it, you drank it, or whatever the case may be. So that was the mode of, that was the means of escape. Either you drank the germ, you ate the germ, you breathed in the germ, however. So then once it escapes, rather it was from your drinking cup or those breathing techniques, then it has to basically transfer. It has to transmission, the mode of transmission. How is it moving? So basically, if you are weak and immune suppressant and you drunk that germ or whatever it is that was growing in that cup, and you poured some juice or some water and you did drink that drink, so now it is in you. But if you are weak and immune, have low immunity, so now it's in you, okay? The bacteria has been involved in you. So now it needs a mode of entry where it's going to enter. And then that's how the germ is perpetrated, really. So we have 6 forms of the infection cycle. Pathogenic microorganism has to be somewhere, because that's how it's a germ is acquired. So then a reservoir, means of escape, mode of transmission, means of entry, and then now who is the susceptible person that is going to get sick. So this is, so to speak, how COVID happened. COVID was the germ of the bacteria. It lived wherever it lived. And then the means of escape, someone coughed or sneezed. Then the modes of transmission, okay, how did they actually get that? Breathe it in, coughed it in, however. And then the means of entry, and then now we have all these people that have COVID because it got into their system, okay? So then when I go further on, these talk about how does the bacteria live, okay? The bacteria needs oxygen to live. It needs moisture to live. You ever heard anyone say, oh no, clean that up, we don't want anything wet in the cabinets? Because if there's something crawling around, most germs love moisture. So you want to be sure your areas is dry. The nutrition, how are they eating? The temperature, most germs live in heat. That's why most hospitals or medical facilities are of a particular extent to where it's cold. That way a germ will not live, okay? Darkness, if it's dark, most germs live in darkness, okay? And proper pH balance. So all of these things is how a bacteria or a germ would live, okay? So when I go over, these are typical germs that we talk about, microorganisms. We got viruses, which is, so to speak, like how COVID was. We have bacteria, we have fungi, and we have more other things available. Okay, so all of these are bacteria that can live and grow. Now, what I want you to start paying attention to, because this is going to be on your quiz. Remember, your first quiz is tomorrow. So I want you to take time. This recording is being recorded. So you guys, I'll send it to you so you can go back and look at it tonight, because I know we had a lot of things going on at the start of the class. So that's perfectly fine. I want you to know that standard universal precautions as a healthcare professional, and for sure as a phlebotomist, which is what you are positioning yourself, we need to, I don't care if you know Mr. Mike as the neighbor and you are the phlebotomist, and he comes in to get his blood drawn and you feel like you don't have to wear gloves because you know Mr. Mike. No, 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 that's not how we do it. The proper standard is that we always wear gloves. We always wear gloves. So this standard universal precautions, every time someone comes in your presence, number one, we already wash our hands before and after each patient, but we also need to be sure we wear gloves. That's called standard universal precautions, just like the video said. It means that we consider all bodily fluids potentially infectious. I don't care if, you know, the patients don't have anything. You still need to wear gloves, okay? You need to use standard precautions with everyone. Please, please, please. Now, you may find it to where someone was in the hospital and you noticed that, oh, they had on a gown, they had on a mask, they had on goggles. Well, now we're getting into different precautions, and I'll talk about that later. But what I want you to remember is standard universal precautions means that you are wearing gloves, and that means that you know that you are treating everyone's bodily fluid as if that, you know, it is contagious or infectious. So always wear gloves. Wear gloves is the first line. Cleaning hands is the first line of defense from preventing germs, but you also have to be sure you wear gloves when you're dealing with patients, okay? Make sure. Now, I'm going to talk about PPE, but just know that PPE means personal protective equipment. Gloves is a part of PPE. But like I mentioned briefly, a gown, mask, goggles, a face shield, all of that is a part of personal protective equipment, because guess what? Just wearing gloves may not be enough for certain people. You may walk into a room where someone has tuberculosis. You may walk into a room where someone has E. coli of the sputum, or, you know, C. diff of the stool or the urine. So if that happens, you need to wear a gown. But I will explain the difference of the PPE and why, when you wear what PPE later. But right now, I want you to soak in that first thing is that we use standard universal precautions. And if it help you, standard and universal means like general. So that should help you to remember as a whole, all standard universal precautions. Again, consider all bodily fluids, blood and bodily fluids potentially infectious, okay? And then, like the video said, I don't know if you heard it, but typically, if it is wet and sticky and it's not yours, do not touch it without gloves. So if you see something that's wet, that's sticky, do not look, don't touch it. Just go ahead, put on gloves. It could be on the counter. Go ahead and put on gloves and use the Clorox wipes to wipe it up. But still, when you're dealing with the patient, once you start to begin to draw their blood, or if you take a cup of urine from them, you need to be sure you have on gloves at all times. Now, each patient, you need new gloves, of course, because you're washing your hands before and after each patient. But when you deal with that patient, you wear gloves. When you take them gloves off from me, then you wash your hands, and then you go to the next room, you wash your hands again, put on gloves, work with your patients, take the gloves off, wash your hands again before you move to the next. That's why it's very important for healthcare workers. We carry our own sanitizer or our own lotion, because you wash your hands so much. So please keep in mind standard universal precautions, okay? Again, this video went into like You ever known anyone? And like I have a cousin in Beaumont, and literally she did, she caught COVID about 3, 4 times, I would say. Every time she texts me, oh, I got COVID. I'm like, what? I know she works at the jail, but I start to think like, okay, you need to just stop getting tested. And, if you have symptoms, just go ahead and quarantine yourself, because this is ridiculous, right? But I said all that to say, you ever heard someone to say they always get sick, they always get a cold? Or you may say, oh, you always have a cold every time I see you. Well, we need to know if how they health stands. So those are the type of people that are susceptible to catching infections. So this means you need to be in good physical conditions. Try to stay healthy if all possible. You need to be in a good emotional state. Stress freaks us out. You may not even know it, but you could be under stress and it starts to weaken your immune system and you don't even know it, okay? We do need to proper exercise. We do need to eat well, good nutrition, proper hygiene, brushing teeth, taking baths or showers, reduce stress, like I said. And then we also need to limit direct and indirect contact. So like I said, if you know someone that's sick or ill, try to limit the contact with them. You are a phlebotomist. Your main thing is to draw blood, get in, get out of there. Okay. So all of these things play a part of how people get sick. So if you can kind of do better with how you treat your body, you should do well. You ever heard anyone say, I keep using COVID as an example, but let's just say, have you ever known anyone to have COVID and then you was around them, but you don't feel sick? You tested yourself, you were negative. Well, that means that your state is your immunity is just better. That's what they were saying too. When people got their vaccinations, they kept saying, oh, people that's vaccinated is passing it to the people that's non-vaccinated and they don't even know they have it. Well, at the end of the day, COVID was COVID, but I just use all of that for an example so you all can know that these are the type of characteristics you need to practice so your immunity can be built, okay? Good physical condition, good emotional state, proper exercise, good nutrition, proper hygiene, try to reduce stress if you can, and limit direct and indirect contact, okay? Also use standard precautions, which I just went over that. Standard precautions, again, means that you're wearing gloves with every patient because your brain is like, ooh, I'm treating everybody as if their blood or bodily fluids is infectious. So be sure that you wear gloves. Standard universal precautions, okay? All right, so this is pretty much the end of the video. I just always like to go over the video like I mentioned. So this says, how are infection agents transmitted? We need to do proper hand washing, which is what I'm going to show you now per the CDC. Remember, I mentioned on Tuesday, I know we all know how to wash our hands, but some people probably don't realize, especially when it comes to healthcare, that it is a proper way to wash your hands, because you're going to be dealing around people all the time. You're going to be dealing with sick people all the time. So you want to be sure that you wash your hands appropriately so you don't bring any germs home to your family, okay? Contaminated instruments. If you are using anything, you always be sure. Okay, you always be sure that those things or those instruments have been disinfected, okay? So it depends. We'll talk about it more in class this weekend. Needle sticks. Remember, I gave you the example that when I was fresh out of school, I stuck myself with a dirty needle. If you happen to do that, please be mindful and follow the chain of command. Wash that area for 15 to 20 minutes with soap and water, then tell your supervisor, and then he or she will send you to the employee health so you can start getting checked out, okay? But just know, if you do stick yourself with a dirty needle and that patient did have something infectious, you can risk contracting whatever that was, okay? Okay, so let me go ahead and stop that video. Good evening, Ms. Lakeisha. I am recording this session. So once this session is over with, I will send out both to you, to both of you, so you can go back and listen to it and kind of, get what was said at the beginning all the way through. Okay. So now that I went over infection control, like I said, I want to go over hand washing. Hand washing is very important. We're supposed to wash our hands before and after every patient. Washing our hands is the first line of defense against infection. Please wash your hands, okay? I don't care if you touch the doorknob in the room after you wash your hands, go back in your station, wash your hands again. It is a number one tool, because the moment that you wash your hands with that soap and water, whatever germ that could have been on the hands was let go, was killed, okay, with that soap and water. So per the CDC, remember, the CDC means the Center for Disease Control. The CDC is the government agency that basically protects the public health, I can't talk today, against diseases, okay? They find out where the disease came from, how to stop it, how to prevent it, okay? CDC. So let me go ahead and just go straight on in to it and move right along with the hand washing. My stomach's gonna growl. I just remembered I haven't even ate. Lord. Okay, let's see.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
Okay, I'm unmuting myself now. I do want you to know that as a healthcare professional, which you are in transition to be, anything dealing with diseases and you have any questions, please feel free to always just go on the CDC website and see if they have any type of updates. any type of disease information for the betterment of the public, they will be the ones to help. Okay. Now let me back up, and when these let's see. Yeah, here we go. So right here, this is very, very, very important on how we wash our hands. We wet our hands, we lather our hands with the soap, and typically lather means we have the suds that came about. We do our front and our inside and the front of our hands. After we came up with a good lather, then we scrub. Depending on where you're working at, they may have like a hand scrub brush, like these disposable packets that you open up, and you can scrub your hands, okay? And in your fingernails. But if they do not have that scrub brush, then basically what they're saying is just taking your nails or your fingers, is just scrubbing all over your hand, okay? Then we rinse. What's important about rinsing that some people probably don't know, or don't care, because technically you're washing your hands at home. When you're in the sink, don't have your hands up in the faucet like this with the water. That means that the water is dripping down your arm. You want to hold your hands down in the faucet. So after you wet, lather, scrub your hands, when you rinse, you put your hands down like this. Therefore, when you do like this to rinse your hand, the water is falling back down into the faucet. If you do your hands like this, and you put it underneath the faucet like this, then the water is just coming all the way down with the soap. And if it is germs that were on your hands, then all it's doing is just going down your arm. So be sure when you wash your hands, rinse them, you have your hands facing downward, okay? So this is the proper technique to wash your hands. Remember, the rule of thumb is it takes at least 20 seconds. A lot of times we're not looking at our secondhand clock. We're not looking at our watch. And typically, how she said, sing the happy birthday song twice. Once you get so experienced with washing your hand, because it's going to be a way of life, you'll begin to know what's proper. You wet your hands, form up a good lather front and back, scrub your hands. When you rinse them and do all this, and then when you dry them, that should be at least 20 seconds, okay? So be sure before you touch any door to leave out the restroom or to leave out the area that you're in, be sure that your hands is dry. Because if you do not dry your hands fully, if you literally just finished washing your hands, if you don't dry them fully and you open up a door with your bare hands and they were wet, germs could be lying on that door. So indirectly, you got germs back on your hands, okay? So, sometimes a lot of people, when they wash their hands, they take a napkin and open up the door. Well, that's fine. But some restrooms and facilities no longer have wipes or napkins in there. They have the air dryer. So we want to just be sure that you dry your hands appropriately, okay? So when washing your hands is just as easy peasy, okay? Makes common sense. Hands is the first line of defense against germs. So be sure we wash our hands before and after each patient, okay? And like I just went over, we want to wet, form a lather, we want to scrub, we want to rinse, and we want to appropriately dry our hands, okay? So this is the gist of hand washing. And I know it's easy, and I knew it'll be easy, but it is appropriate in your healthcare professional course is to properly show you and demonstrate for you to see how to wash your hands, because like I said before, you can work in a facility that they had inspection come that day, and they may pull you to the side without no warning and say, okay, I would like to see you do the hand washing technique for me. Okay, so just keep that in mind, because I need you all to, just be sure you understand standard precautions. We wash, standard precaution is that we are assuming that everyone's blood or bodily fluids is infectious, okay? We want to be sure we wear gloves. When we wash our hands, we want to wash hands before and after each patient. okay? And then when we wash our hands, we want to be sure that we appropriately wash our hands for those 20 seconds, okay? So let me know if you have any questions regarding hand washing. All right, so let's move forward. So we went over the infection control cycle and hand washing. So now I want to jump back into phlebotomy. On Tuesday, remember I showed you guys the whiteboard on what phlebotomy means, what phlebotomist means, and what venipuncture means. From here on out, if I use the word venipuncture, you should know that that means that's the whole technique. When you draw someone's blood, you're puncturing their vein with the needle. Remember that phlebotomy means that you are performing the skill of phlebotomy all day long when you're drawing someone's blood. It means to cut through a vein, which that's what you're doing with a needle, okay? So with that being said, I have a little flash. It's not a video, but I do have some flash cards that I want to review that I'm going to share with you. Let's see. Oh gosh, that's not, I was not showing a video. Hold on. All right, so let's talk about the role of a phlebotomist. Now, on Tuesday, I did show you a video that basically gave you the job duties of a phlebotomist, right? It told you about the job duties of what you're gonna do, from interviewing the patient, from doing the venipuncture procedure, from labeling your specimens, from transporting them. That video showed you all that. So all of that is what you two are gonna learn in this 3-week accelerated course, okay? Now, I just want you to reiterate, what are your job duties? What is your role? What will be your role as a phlebotomist, okay? So your role would be select appropriate supplies and prepare patient for the procedure. Remember, it's a procedure. It's not a surgery, but it is a procedure because you're taking a needle to cut through their skin. So that's still pretty important to make sure that you do appropriately, okay? So I'm going to teach you on how to grab the correct supplies. I'm going to teach you on knowing what the supplies are, what you need, and all that good stuff. Your role is to collect routine capillary and venous specimens for testing as requested. We're going to go over. Capillary is when you stick someone's finger or you stick the baby's heel. Venous means when you get venous blood from a vein. Anything that you see that has the word B-E-I-N or B-E-N, B-E-N puncture, just kind of remember that has something to do with the vein, okay? So venous means you're doing a venipuncture and you're getting venous blood. You're getting blood from the vein, which is all the same thing, okay? So in a minute, as I go through my lectures and go through my teachings with you in person, I'm going to explain to you, I don't want you to be surprised when the exams ask you questions to trick you. I'm going to let you know what are all the tricks, okay? So therefore you can be prepared, because dealing with healthcare and especially with phlebotomy, some of these words mean the same thing. There are different words, but they mean the same thing. So in one test, it may tell you something about phlebotomy and then something about venous blood. Then you're confusing yourself because you're like, oh my God, they asked me something this way earlier versus somewhere this way. So I'm going to be able to explain to you on how to decipher everything, okay? As a phlebotomist, you're going to prepare specimens for transport. You may go to work one day and your supervisor will tell you, okay, Lakeisha, you're not going to draw blood today. I just need you to transport the specimens to the lab. That's still a role of a phlebotomist, okay? Transporting the specimens to the laboratory, that's a role. You also may promote good relations with the hospital staff and patients because you're going to see them all the time. Comply with new and revised procedures as described in the procedure manual. Your hospital or your facility that is their responsibility to get you comfortable with their facility protocols and guidelines. So I'm going to teach you the role of a phlebotomist, but your facility is going to put you through training and orientation. Like I already said, I repeat myself a lot, but it's just for you to remember and to intake everything that I say. So just keep in mind that your facility will show you their procedure manuals, okay? Role of a phlebotomist. Let me go ahead and show you the next one, which is a continued role of a phlebotomist, okay? More information to know. Now, you would also document procedure according to the facility protocol. So it's not all about just, you're gonna do blood work. You're gonna also do paperwork, okay, which your facility will train you. So after you did your procedure, your job at your facility may be to document what you did on that patient and what arm you took blood from. Where is it to, you may have a friend that works in another lab and they may say, girl, we don't do that over there. Well, remember, facilities are different, so you go by what your facilities say, okay? So documentation is important. You will also demonstrate understanding of emergency procedures, okay? Which is why we're gonna do CPR and different complications, like what if your patient, you're drawing blood, your patient passes out? What if your patient starts to vomit while you're drawing their blood? What if your patient starts to have a seizure while you're drawing their blood? We'll talk about things like that so you can be prepared, okay? You will also assist in collecting and documenting monthly workload and recording data that your facility will train you on. You need to always make sure you maintain safe work conditions. You will perform laboratory computer operations. So hopefully that you're comfortable with at least the basic necessities as working a computer, because nowadays everything is pretty much technology, and a lot of facilities go to the computer for training and observation, even with the notes, the documentation, okay? Participate in continuing education programs. I'm going to let you know about that, because when it comes all the way to that, when you take your exam, in order to keep up your certification every 2 years, NHA is going to have you do continuing education courses. Basically, it could be like an hour or two course online just for continuing education. It could be about anything. It could be about heart attacks. It could be about strokes, whatever it is that they're doing. Just know that, you know, you do renew your certification every 2 years, and you would have to do some type of continuing education, but it will be something that NHA would let you know, not through me, okay? But those are requirements to keep your certification up. Also, you will perform other tasks assigned by your supervisor personnel. So if your supervisor tell you, okay, Chelsea, well, today, what I want you to do is look at the schedule and, you know, see how many people's coming in for lab work today and let me know what number. Then you may say, I didn't know phlebotomists do this. Why the secretary can't do this? Well, if your supervisor explained to you that's a job duty in your facility, you just, you know, have to do it. So that is the reason for this statement. Perform other tasks assigned by your supervisor, okay? Let me move forward. Now, I think I mentioned to you that I will talk to you today about where can phlebotomists really literally work like that. You know, where can they work? So phlebotomists can work in different genres of healthcare settings. The following are common settings that may employ a phlebotomist. You can work in a doctor's office. You can work in an outpatient lab, like a LabCorp, a Quest, excuse me, any freestanding labs that is not inside the hospital or is not inside the doctor's office, okay? Phlebotomist also works in the hospitals. Phlebotomist also works in urgent care centers. It's like an ER, but not like an ER. We should know that an urgent care is just these small little entities that you go for emergency, which is urgent, but not so major, okay? Nursing homes. Phlebotomists work in nursing homes, meaning that you may work for a company that does mobile phlebotomy and they happen to have a contract with nursing homes, okay? Also, you can work in a wellness clinic. I'm gonna throw it out there. Let me just throw out Planet Fitness. You know, Planet Fitness is a gym, but they may have a section that is all about wellness, and you can come in there to check yourself out here and there. And so they may hire phlebotomists, you know, to do those blood works. Also, insurance companies. You would be surprised if you look up different insurance companies: Community Health Choice, Molina, WellCare, Amerigroup, Blue Cross Blue Shield. They hire phlebotomists, okay? So some of these you have to have experience to even have them even look at your resume. But a lot of them that I mentioned hire brand new. And so to speak, plasma centers and blood donation banks, they hire brand new, which is where a lot of my students have been getting hired at lately. I just got a selfie from one of my students today, right before class, that she started today, you know, so, and she works in a plasma center. So I just want you all to be mindful that working as a phlebotomist, once you get there, it's different areas that phlebotomy works in, okay, or that phlebotomist works in. Also, lab personnel. So you may, let's just say you advancing and you're working in a hospital. You may not draw a person's blood all that day, but you're working in the lab. So if I was the phlebotomist and I'm bringing you the blood work, you may be working with the medical, you may be working firsthand with a medical lab person that looks under the microscope, separates the blood to get the results. So that is a step of phlebotomy, okay? If you've been job looking already just to see what's out there, and you notice like a phlebotomist 1, a phlebotomist 2, phlebotomist 3, that is the top tier different levels of a phlebotomist. And you get that training on the job, okay? So they may pull you from drawing people blood today and pull you just to work in the lab. So you don't see no patients and you're just working with the medical lab director to just working with the blood samples, okay? Phlebotomist, a technician who's received specialized training to collect specimens and transport them to the lab for testing. They may have on-the-job training or formal education, which varies in length. They may also hold a notification throughout one of the several entities, such as National Health Career Association, which is who I use, and that's who you're going to take your national exam with. There is other entities that certify you as a phlebotomist to take when you take your exam, but NHA is the top 3. So I signed up with NHA with my institution so I could be a testing site. So the same room or classroom that you're learned in, I wanted all my students to come back to take their exam. I didn't want to have to tell you, okay, you have to sign up with a Prometric center around the city and go take your test. No, I want everyone to take their test with where they are familiar at, with where they learned, okay? Any questions so far?
I have one question. So I know you said that we have to recertify every 2 years. Now, do they email you to do that, or do they have you actually come in to redo it?
No, and it's something that I will talk to you about once you take your test and when you pass it. But to renew your certification, they email you. They start to email you like 2 months to a month before, so you can make sure you get that continuing education done, which is done online. Like I said, it's about an hour or 2. It's like some online type of, you know, quick readings, and you answer questions, then you get a certificate that you completed it, and you upload it to them, and then you just pay the fee to renew your certification. But they'll email you and let you know, because you'll once you get ready to take your test, you will have an NHA account because you have to register. And so that's the same information is where they're going to send to you, to your email.
Sweet, thank you.
All right, you're welcome. All right, so I want to move forward to the anatomy of the needle. I don't know if you have your folders with you, but you should have a diagram of a picture of a needle. And I want to be able to explain the needle to you and some of the important topics of the needle, okay? Remember, this is recorded, so I will, once it uploads to my computer, I will be able to send it to you from my YouTube link, okay? All right, give me 1 second. One second. Okay. Now, this is the same diagram that you have in your folder. The difference right now is that I'm showing you a syringe with the needle attached. The most important part for us is the needle, but I do still want to explain a syringe because it could be a part in your phlebotomy career where you may have to use a syringe to draw a syringe with the needle to draw someone's blood because they could be, you know, old, so old to where their veins are fragile. And I don't know if you ever heard this terminology, but you finna get ready to be familiar with a lot of phlebotomy terminology. Is that if you heard someone to say someone veins collapse, meaning that you felt the vein, but as soon as you stuck the needle in there, the vein just collapsed. Well, it could be because their veins are so fragile, so therefore you would have to use a syringe. But I will go into why in person on Saturday because it's better explained in person. So when I do hold the syringe out, you will understand, okay? Now, but just for you to understand the anatomy of the syringe, you see the long part that goes inside the barrel of the syringe is called a plunger. That's how we know how much medication you have put into the syringe, okay? We have the plunger. But then the middle area, which is called the barrel, the main syringe, where you see the lines for measurements, that's how we know how much medication or blood is in these syringes from the barrel, okay? Now, what I really want you to pay attention is now we're gonna connect our needle, okay? So we have the hub to the needle. Let's just say you had the syringe and then now you had a needle in a separate packet. You opened up the packet to the needle, you attach the needle hub to the syringe, okay? Now, I do want you to understand the whole metal part to the needle, you will never stick the whole needle into someone's veins. No, even though it's lengthy like that, you're not sticking the whole needle. Okay, now the whole metal part of the needle is considered the needle, but you're only sticking the needle into someone's vein as far as the shaft. So when you look at the diagram that's in a circle, meaning that it magnified the edge of the needle, I really need you all to make sure you remember the shaft, the lumen, and the bevel. The shaft is the area of the needle that goes 3 to 5 inches past the opening of the needle, okay? Also, lumen means the inside of the circle. How big is the inside of that circle? That's why we have different size needles. We have small needles, we have medium-sized needles, we have large needles. And what makes it small, medium, or large is how big the opening to that needle is. Now on Saturday, you're going to look at all your supplies right in front of your face, and you're going to see the opening to the needle, okay? Now, the lumen is how big that hole is, but the bevel is considered the actual hole to that needle, okay? I'm going to be able to show you every time you do a venipuncture on someone, every time you do a blood draw on someone, that bevel needs to be facing upward, okay? Not downward. Okay, so I will explain to you about the bevel, but I need you to review this video tonight when you are concentrating more harder, because it's very important to understand the anatomy of the needle. We definitely need to be sure the bevel, which is the actual opening of the needle, is facing up. The lumen is how big the opening of that needle is. What size is it? Okay, then we have the shaft. The shaft is 3 to 5 inches. Once you stick that needle in my arm, then you go ahead and advance 3 to 5 inches, a little more, and that's where you stop. That's exactly where you stop with the needle, okay? Once you actually go in. Any questions about the actual anatomy of the needle? All right, no questions. You guys understand? The bevel needs to be facing up. In person, I would be able to tell you, because if the bevel is facing, let's just say you see my nail and the nail pointing like this is downward. When you insert that into someone's vein, it's gonna hurt because the pointy part of the needle is downward. But if you have the bevel upward, when you stick into someone's vein, that's how the blood flows through the needle from that opening, okay? Remember, the
We're
lumen—
pretty much tilting it, right?
Huh?
Putting a tilt to it on the needle, right?
Uh-oh, it's kind of like robot sound.
Oh, can you hear me?
Yeah, I can hear you. It's just, I don't know if it's the internet, but okay, say it again, try it again.
So instead of going like this, you kind of tilt it up so it don't mess with them, right?
We'll talk about the angles later when we start actually working with how to insert it, but I just need you to know basic things first. I need you to know the opening of that needle is called the bevel. It needs to be, excuse me, it needs to be facing up. We're not going to worry about the angles, how it goes into someone's vein yet, but I do need you to know that the bevel is facing up. So if I ask you, are we going to face the bevel? The bevel is facing upward or downward? I need you to tell me upward. And that is the opening of this, of the needle, at the tip of the needle. And you're going to see it in person on Saturday. But it needs to be upward, because if the bevel is downward when you go into someone's vein, the blood has nowhere to go through the needle so you can get the blood. The bevel has to be up, okay? Bless you.
Thank you.
I had a needle here. So literally, we're on virtual, so I don't know how well you can see it. I always do this and I say the same thing. But if I put the needle close to the camera, if I turn it around, you can kind of see the opening, the bevel. Right here, the opening, the bevel. And the bevel is considered up right now. That's the way you're going to go into someone's vein. Now, if the bevel is downward, you see how I just turned it from up to down? And you see that pointy part is what's going to go into someone's vein first. Well, the bevel is down now. So when you stick that into my vein, the blood has nowhere to go. So the bevel has to be up. And this is the opening. You kind of see the opening right here. And it needs to be up facing the ceiling, not downward, okay? So you're gonna be able to see that, and we're gonna demonstrate that so you can know that the bevel is up, because that is the first practice when you start doing your venipunctures on the actual vein pad, I need to see you make sure that you know that that bevel needs to be up, okay? The angles and how you go in as an angle, that's going to happen on Saturday. I'm just telling you in steps, okay? So if I ask you, what is the lumen? What does the lumen really mean? What is the part of the needle that says the lumen? What does that mean? I hope that you tell me that's the size of this hole of the needle. If I ask you what's the bevel, you should tell me that is the actual hole of the needle. The lumen is the size. That's how you know what size needle you have, okay? So I need you to know and to remember these things, okay? Now, what I want to tell you about the needle, that's very important because it's going to be on your quiz. Oh, hold on, because I'm doing something. You know, I'm visual. You all should know that now. This is day 2. So trust me when I say I like to show everything. So that's why it's very important for you to kind of take heed to what I'm showing, because I take the time out to make sure that I show things to make sure you all, you know, understand. Hold on. Oh my gosh. Now, when we talk about the sizes of the needles, now I just talked to you about the anatomy of the needle, okay? I just did. The anatomy of the needle, which had a syringe attached to it, but the needle was the most important part, okay? We have the shaft of the needle, the lumen of the needle, and the actual bevel. Well, looking at this diagram right here, you see you have different colors to these needle hubs that you attach to a syringe. You may notice that, ooh, this 14 gauge, ooh, that hole up there is big. 15, 18, 20, 21, you see it's starting to get smaller. 22, 23, 25, 27, 30. You see the opening to those needles, it starts to get smaller when you're going down here to the 30. So what I need you to understand is, I just explained to you that the bevel is the actual opening to the needle at the end, and the lumen is what size that hole is at the end. So these are the sizes of needles: 14 gauge, 15 gauge, 18 gauge, 20 gauge, 21 gauge, 22 gauge, 23, 25, 27, 30. But what do you notice about the sizes that really is like, oh, just, I'm gonna take a second to see if you can tell me, what have you noticed about these sizes, which I just said, but I just want you to tell me, what have you noticed about these sizes of the needles?
They're all 1/2 inch.
Huh?
They're all 1/2 inch.
1/2 inch, okay, 1/2 inch, but what else? I'm looking for something else.
They all have different holes. That sounded wrong, but the holes are bigger on the 14, 15, 18, 20, and then it just gets smaller and smaller and smaller.
So tell me more. So the average, what you would think is a 14 and a 30 is higher than 14, right?
Mm-hmm.
So
yes,
you would probably think that 30 is the bigger needle.
It's the bigger.
But see, these sizes is vice versa, right?
Right.
So now tell me.
The higher the number, the smaller needle. I was saying this wrong. The bigger the needle, the lower the number.
So exactly. So in phlebotomy, nursing, healthcare, period, if somebody tell you, give me whatever size, 18, 14, whatever, I need you to know the smallest number size is really bigger than needle. The biggest number size is really the smaller the needle. That is so important in basic blood draw. So I just told you that the bevel needs to be up The bevel is the hole of the needle. I also told you the lumen is what size that hole is. So now we've learned 14, 15, 18, blah, blah, blah. So the hole of that needle, the lumen size would either be 14, 22, whatever, okay? But you know that, okay, if I ask you on the test, I have size 16, 17, and 18. Which one of them is the biggest needle?
Be 16.
16, correct. Good job. So the most common size, and I'm gonna review the common size needles in person, but I do need you to understand the smaller the number, the bigger the needle, versus the bigger the number is the smallest the needle. I need you to understand that. But then I will let you know and let you see in person what is the average size needle that you're going to use. Okay, now you know that. Okay, you know the number sizes and all of that. But you're probably thinking, well, what size we're going to use? Typically, what size we use? So there is areas to where you're going to use average size needles for people, just averagely. And those needles are 21 and 22. So size 21 and 22 is for, basically, that's what you're going to use all the time, 21 and 22. Okay. Now, the other three that I just mentioned, 16, 17, and 18, those are the most common size needles that you would use if you work in a plasma center or a blood bank. When you stick someone, you're going to stick them with either a 16, 17, or 18. Remember, they are bigger than the 21 and 22, but it's done on purpose, because if you work in a plasma center or a blood bank or vice versa, let's just say you went to donate your blood or your plasma, they're using a big needle on you because you're donating blood and plasma. So that needle needs to be big. Okay, that means it's so much blood coming out, the needle needs to be of an appropriate size. So please remember, the most average size needle that we use for venipunctures to draw someone blood, average size is 21, 22. But then the needles that you use for blood banking and plasma center is either 16, 17, or 18. So if you're tested, it's not going to trick you in such a way. It's just going to say 16 through 18. So if you have a question that says, what is the average, what is the needle size for blood banking? And so it could be, 14 through 16, 16 through 18, or 20 through 24. So hopefully what I just told you, you would choose B, 16 through 18 is the average size needles that you would use for blood banking. But for just regular blood draw, to just get tubes, it's 21, 22, okay? But I will teach you about the butterfly, which is a smaller needle that I have in class. That's a 23. That can be a 23 or a 24 size, okay? But we'll talk about that later. But now, going back, we talked about the actual needle, what the actual needle looks like, okay? What does it mean, okay? Remember, we want to know the shaft. When you insert the needle into someone's vein, you are basically just going to the shaft part of the needle. You're not sticking the whole needle into someone, never, okay? That's why some people are scared. They see this needle and they like, oh no, now, if you were giving someone a shot, like an injection or a vaccine, that's different. Yeah, the whole needle goes into someone's stomach or arm or whatever. But when you're drawing, when you're using a needle to draw blood for venipuncture, you're just inserting enough to cover the bevel. So when you insert the bevel into someone's skin, you're inserting it to where you no longer see the bevel anymore because it's in the vein. Then you go back in at least 2 to 3 inches to the shaft. You're not sticking the whole needle into someone's arm, okay? Then to go back, to reiterate the size of the needles. Remember, please remember, the smaller the number of the gauge of the needle is really a big needle. The bigger the number of the gauge of a needle is really a small needle. Okay. And when I talk about big and small, I'm literally not talking about the length. I'm not talking about the length of the needle. I'm just simply talking about how big the hole of that lumen needle is. Okay. All right. Any questions about the anatomy of the needle or the needle sizes at all?
No, ma'am.
All right. Well, let's move forward because now I want to get into the order of veins, because now you need to know what veins do you even draw from when we're doing blood. Okay. Some people don't know exactly, okay, what are the veins that we're going to draw from again? What is a vein? What is an artery? So I'm going to introduce, I'm probably going to end a little early because after I do the order of the vein, I do not want to go into another topic, because everything else is simply meant now for Saturday and Sunday for your eyes to see and for me to be right there when I teach you. Okay. So with that being said, give me 1 second.
So in the video, when I look at it from the beginning, because I know I missed because I was getting off late. So there's some things in there that I need to write down that's gonna be on the test whenever we do have a test that I need to know in the video.
Everything, I'm gonna just say this because I know that you, yes, I have recorded the video and I knew that you were gonna be late. I record the video, and then Miss Chelsea, she had some things going on. So I did record the video specifically for you guys, but I don't want to confuse you, but everything I say is important. And if I tell you that, okay, the test is not going to be concentrated over this per se, at least you'll know what information to review, but not to give all your time to. And so I make sure I say that. But other than that, everything is important. Just like you will hear it in the video when I send it to you from the beginning, the infection control cycle that I went over, it is important for you to know in real life, but the actual exam won't cover just the infection control itself, but it's important for you to know how to deal with it in real life. But yes, everything that I go over is important. Will be on the quiz.
Okay.
And the video has been recorded since the beginning. So you'll be able to hear everything that was missed earlier on. Okay, give me one moment. Because now all this information that I've been going over is I mean, everything, Tuesday, HIPAA, OSHA, CDC, professionalism, all of that is on the test. I will, like I said, I will let you guys know what areas to relax a little bit on when you study. Basically, that's what, yeah, that's how I should word it. Everything is important, but I'll let you know what areas to relax on when you do study. All right, so right now what I have in front of you showing on my screen, it is a human arm, you know, a picture of a human arm. You see these veins right here? Now, this is being recorded, but you also have it in your book. When you look in your book, remember you have a whole textbook. So I need you to get yourself familiar with the veins. I'm gonna show a video. I'm showing this picture. I'm gonna explain it, and I'm gonna show a video, and then I want you to go back and look in your book for the veins, and I'm gonna tell you right now what page. And that's why I try to tell you what page. So if you're not going to read the whole book from first page to last page, at least you know the pages that we went, you know, that is important that I talked about. So give me 1 second. I thought I had it written down. I'm sorry. I was
The father's date. Let's say August 5th, August 4th. No, August. Where?
Oh, something is in the house, flying around. Let's see. Oh my God, I don't like things that fly around. I don't know where they're going to land. Let's see. So on page 126 to 127, it talks about the order of veins that I'm going to explain. So when you listen to this video again, you'll be able to hear those pages, okay? Then it gives you pictures of different skin types. I will talk about it when we meet in person. It does kind of matter in phlebotomy to get you a little bit comfortable on the color of someone's skin, because when you're learning, you may say, oh my God, I only practice on light skin, or I only practice on, brown skin. I'm going to teach you how to properly look for a vein, no matter what color a skin tone is. And the reason why I bring that up is because some people are comfortable with seeing a vein. You need to be taught how to feel for the vein. That way, when you're taught how to feel for the vein, you won't get nervous if you can't see it. Okay, but when you feel it, is there. Okay, so 126 and 127 is the order of veins. So right here, very important, I need you to realize that in the middle of your arm here is where you're going to draw blood from. Let me get in the video here. Right here in the middle of your arm, like this. Not the forearm, but the middle of the arm. You have the area of the arm and the hand that we're going to talk about. You are not drawing blood anywhere else on the body, but the area of the arm right here and the hand. Okay, there is a order of veins for you to follow. For example, the medium cubical vein is the first vein that you will look for. Okay, rather it's in the left or the right arm. If I have a medium cubical vein that's poking out or sticking out, bouncy and spongy, then by all means, it's there. But if you don't feel it, maybe I'm dehydrated, I'm sick, and maybe you don't feel it in me, because being dehydrated also gets in the way for you feeling for a vein. So let's just say that medium cubical vein is not there. In either arm, you don't feel it. Then we go to the second vein in order, which is pronounced cephalic. CEPHALIC, cephalic vein. That is the second vein to look for. Now, when you look at this dialogue, you see it's kind of like a tree, the medium cubical and the cephalic. The medium cubical is right here in the middle, and it branches off like this. And then your cephalic basically comes straight down your arm on the side of the medium cubicle. So when we're in class, we're going to feel, you guys are going to feel my vein. I'm going to feel yours. Y'all going to feel each other. So you can get used to feeling what a good vein feels like. Okay. We're not going to do any real sticking, the weekend. We will stick the mannequins and the blood pad, but I still need you to feel for a vein in each other so you can know what it feels like. So first vein of choice is the medium cubical vein. Second vein of choice is the cephalic vein. Now, you see this little bitty vein right here on his arm, and you see it says on the side, accessory cephalic vein. Those little bitty veins is okay to draw from. It is a branch of the cephalic, you see? So that's still a part of the second order of vein, okay? Now, you see down here, you see basilic vein. Basilic vein, if you think about underneath your arm, it lies on the inner side of the arm. The cephalic basically comes from the top of the arm and it goes to the outer edge of the arm, the outer side of the arm. The cephalic actually goes all the way into the hand, that vein. But right now, I need you to know medium cubicle, first vein of choice. Cephalic vein, second vein of choice. Basilic is pronounced basilic, B-A-S-I-L-I-C vein. That's the third vein of choice. So in the arm area region, it's only 3 veins I need you to know. This is the phlebotomy protocol. Medium cubicle vein, cephalic vein, basilic vein. You have 3. So if you're feeling for my vein to draw my blood, you feel for my medium cubicle first. If you don't feel that it's there because I'm dehydrated or I have some type of sickness that it collapsed my veins, okay, check the other arm, the medial cubicle. If it's not there, okay, go back to the other arm, check for the cephalic. If you feel for the cephalic, you feel it. If you don't, then check the other arm, cephalic, okay? Then vice versa to come back to the basilic. Understood? So medium cubicle vein is first, cephalic vein is next, second, basilic vein is third. So you follow that in the order of vein. That's just the phlebotomy standards. That's what the standards and the protocol in phlebotomy is, that you look at those veins first, okay? If you've ever had anyone that was in a hospital, if you were in a hospital yourself, or if you had an IV, the smack dead in the middle of the arm is typically what people draw blood from and sometimes give you an IV. That's because that's the first line, that's the first vein that is always accessible to everyone. It's a big vein, okay? But what I would like to say about the basilic, I just told you that it is third in the order of draw. But until you become confident in your blood draw, as a new phlebotomist, please, in real life, do not draw from the basilic vein. Because if your angle that we're going to learn about this weekend, if your angle is too much and you go for that basilic vein and you go past the vein, there's an artery and nerves right underneath that basilic. So basilic vein in real life, just only check for medium cubicle and cephalic in both arms, okay, in real life. But just know we have 3 veins, medium cubicle, cephalic, and basilic, okay? But in real life, we don't want to really mess with that basilic if you're not confident in it, okay? And let's just say you check the medium cubicle and the cephalic in both arms and you don't feel comfortable because you don't feel anything. Let your coworker feel my veins then. It's okay, call your coworker, okay? So any questions with the order of veins? Okay, so let me go ahead and play the video that we're going to go ahead and complete the night with that talks about the order of veins. Now, don't let me get you like, oh my gosh, she just said a lot today. Remember, you're going to listen to this recording. Once I'm done with it, it does have to upload. Then I'll send it to you in a YouTube fashion. But I will go over a lot of this on this weekend because it is getting into the phlebotomy, because this weekend we're going to learn the supplies. We're going to learn the angles of how to actually really stick someone. I'm going to do a activity for you to get good with the needle, how to hold it, how to do your tubes back and forth, you know. So all of that we're going to do this weekend. But I do need you to pay attention, because as we move in the process, remember, everything is accelerated. So as we move in the process, I do want you to be some kind of familiar with things. Then at the end of the whole course, that's when you'll spend time with me if you need to do one-on-ones to go over some of the material, okay? So give me a second. Let me start the order of vein. It's a little over 5 minutes, the video, so give me 1 second. And remember, the order of veins is on page 126 and 127. I keep saying it on the video, so you can hear it.
Economy Solutions presents the order of veins. The following is part of the CLSI standards. All right, let's take a look at the order of veins. Just like the order of draw, there is an order of veins that we need to follow when we're attempting to draw blood. So as you can see, we have three major veins we need to look at. The first is the median cubital vein. This is the primary vein we should be looking for when inspecting an arm. Second, if the median cubital vein is not accessible, then we should look second to cephalic vein. Now, in case cephalic vein is not accessible as well, then last we should consider the basilic vein. The basilic vein should always be considered last when inspecting an arm. Now, if all three veins are not accessible on the arm, then we need to look at the back of the hand. Now, the back of the hand veins are referred to as the dorsal metacarpal veins. Now, with this, there is no specific order to drawing hand veins. Whatever vein you feel comfortable with when inspecting the dorsal metacarpal veins on the back of the hand, then you can attempt to draw any one of those veins. Now, when we're looking at the area to draw, we must remember that this area is called the antecubital fossa area. This area is where all three veins lie, the median cubital, the cephalic, and the basilic veins. Now, I recommend highly to follow this order. First, look for the median cubital, then the cephalic, and then, of course, the basilic. Now, if those three veins are not accessible again, we go to the back of the hand veins, which are referred to as the dorsal metacarpal veins. Then, with the dorsal metacarpal veins, we can look at the wrist area, or where the watch goes. This is the standard order we should follow when inspecting an arm. Now, my recommendation is if the median cubital is not accessible and the cephalic is not accessible, I would definitely skip the basilic vein and go to the back of the hands or the wrist area where the watch goes. And in a minute, we're going to see why that's important. That selecting the basilic vein should always be a last resort if the back of the hands and the wrist veins are not also accessible. And a final note, there are no forearm draws or inside the wrist draws. That is against the standard of care. And again, foot draws are only with an MD approval. So if there are no veins located anywhere in these areas, including the back of the hand and the wrist, then we would get an MD approval for a foot draw. And again, the forearm is not to be considered, or the inside of the wrist. Okay, so as I mentioned earlier, the vein that we need to avoid or even make an attempt on completely last is the basilic vein. Now, the reason for this is because it is near the brachial artery. In fact, the brachial artery runs just underneath the basilic vein. So if you put two fingers over the basilic vein area, you should feel a pulse if you push down hard enough and wait. That is the brachial artery. We want to avoid the basilic vein because it's a higher risk of puncturing the brachial artery. And in fact, we want to avoid any internal bleeding that can occur if we do puncture that brachial artery. So again, the basilic vein is a last resort, last attempt if all other veins are not accessible, namely the median cubital, cephalic, the back of the hand, or the wrist. Then the basilic vein can be looked for if nothing else is available. And again, we want to avoid doing any kind of harm or damage to the patient. Also, there are nerves that run parallel with the basilic vein that if we're not careful, we might nick or hit with a needle, can cause nerve damage. So we have a possible high risk of arterial puncture and also hitting a nerve or doing nerve damage while trying to access blood from the basilic vein. So again, basilic vein should always be attempted last when all other veins are not accessible for venipuncture. So in conclusion, always follow the order of veins when inspecting the arm, the median, cephalic, and basilic vein. This is inspecting both the right and left arm when attempting a venipuncture. Always select basilic last when all other veins, including the hand, are not available to draw. This is again avoiding an arterial puncture and possible nerve damage. Now the back of the hand has no vein order when selecting. The wrist is part of the back of the hand, and never draw the forearm or inside the wrist area. So the dorsal metacarpal veins have no specific vein order. Whatever vein you find in the back of the hand and feel comfortable drawing, then make your venipuncture attempt on that vein. And again, never draw the forearm or inside the wrist area. That is against the standard of care. And of course, if nothing is accessible on both arms or the hands, then the foot can be considered, but with an MD approval first. Thank you for watching.
Okay, just a little bit. Let me go over it. And again, this is recorded, so you'll be able to listen to it again. Okay, now I want to go back to the beginning a little bit just to kind of reiterate. As you can see, that this was the same picture that I actually showed a minute ago, just with the picture. And you see the top three veins is the medium cubical vein, cephalic vein, basilic vein. Same picture, okay? So I need you to remember the anatomy of the veins, because when we start to feel for the veins, you'll be able to say, okay, this is the medium cubical vein. This is the cephalic vein. This is the basilic, but I'm not going to draw from the basilic. Did you hear in the video where I also mentioned that the basilic vein has those nerves and those nerves and arteries? That's why we avoid drawing from the basilic vein until you become an experienced phlebotomist. Just like this, vein to avoid, basilic vein. It's near the brachial artery, and you can possibly puncture an artery. If an artery is punctured, the patient can bleed out, and it takes a lot to stop the bleeding from an artery. So just to help the situation, let's just not mess with the basilic. But if I was to ask you what is the order of veins, all three of them, you should be able to tell me medium cubical, cephalic, and basilic. It's just in real life, when we start doing the act, don't touch the basilic, especially you don't want no problems, right? Now, when I back up a little bit, when it talks about, this is the same difference of the veins. It's just in an animated type arm. We got the cephalic arm, the medium cubical arm, you see vein, sorry. Then you see the cephalic vein, it continues to go. It actually continues to go all the way down to our hand, okay? Now, and then you see this basilic vein, okay? So that's why it's important to kind of know the little dimensions of the veins. You only have 3 veins. You do have the accessory vein that I showed you from the cephalic, the little bitty little corner veins that you could draw from, because in actuality, if you remember when I told you with the needle, all you do is stick the needle in enough to the shaft. You're not sticking the whole needle in. So those little bitty accessory veins is long enough. That's all you need, okay? So the whole area of the arm that I just showed you, like this whole area of my arm, it is called the antecubital fossa. So within the antecubital fossa area of your arm lies the medium cubical vein, the cephalic vein, and the basilic vein, okay? The area of the arm. So if I ask you what area of the arm are we drawing blood from, try to start getting yourself into the position of saying the antecubital fossa area, okay? If I ask you what 3 veins lie in the antecubital fossa area, in order, hopefully you can tell me medium cubical vein, cephalic vein, and basilic vein. Okay, it's just something over the 3 weeks that you will get used to. Okay, so by the time the 3 weeks is over, you would know. I will throw out pop-up questions every now and then anyway to test you, so it can help you learn to get that information out. Okay, one more thing, you see where it says wrist, watch area, versus no forearms or inside of the wrist, okay? So our forearms is the forearm part of our arm. We never draw blood from there. It's always the inner side of our arm, the antecubital fossa, okay? We never draw blood here in the inner wrist. That's the no-no. Now, you may walk into someone's room and they have an IV there. Okay, that's different for IVs. The nurses did it. But when we're drawing blood, it is very uncomfortable to draw blood from these little bitty veins. So when the video said no forearms and inside of the wrist, no inside of the wrist draws. But you can draw blood in this area of the wrist where the face of the watch is supposed to go if you wear one, because that's a part of the hand, okay? Right here where bracelets and watches go. So if you find a vein right here, okay, that's a part of the, if you find a vein right here, it's a part of the hand vein, so you can draw it, okay? Now, when it goes into speaking about the hand, the actual hand veins, and did you hear him say there is no order of vein in the hands? What that means is the veins that you find in the hand, if they spongy and bouncy, that I'm gonna teach you how to recognize, how to feel for, go for it. Because the veins have the hands have multiple veins in them. So if they're spongy and healthy and bouncy, you can draw from it. It's no order like it is in the hand, in the arm, okay? Hopefully that makes sense. I'm trying to get to the picture. Here we go. So dorsal metacarpal veins. You can get used to seeing metacarpal. That means fingers. I will go over it next Tuesday. Most of the virtual is medical terminology, and the quiz is going to be medical terminology after that. The whole quiz is over medical terminology for phlebotomy. So metacarpal is just something for you to start getting familiar with. All that means is fingers. Okay, hands and fingers. Metacarpal. So you see right here, there is no specific order to drawing hands in the veins, to drawing hand veins. So you see you have all these little bitty veins here, and you look, there we go, the cephalic. You see the cephalic kind of comes right here above the thumb, then it curves, and then it goes kind of like into a finger, okay? That cephalic vein is a long vein. But if you find any spongy, bouncy veins that I'm going to teach you how to recognize, go for it. There's no order of vein, okay? Now, I know today we went over infection control. We went over hand washing. We went over the anatomy of the needle and then the sizes of the needle. And then we also went over the order of veins, and I did go into the phlebotomy role also in the beginning and where phlebotomists can work. So this video is, I'm gonna go ahead and stop the recording because